This is a 35-year ultrasound of a 35 years old female, Paris. I'm showing you the subcostal liver, and what we see in the liver is rounded hypoechoic areas, well demarcated, solid because we do not see any posterior wall enhancement. This is another one. Now there are multiple, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 in this view. This is the gallbladder. The liver shows diffuse increased parenchymal echogenicity, and this is the left lobe. Here. Now you are seeing the left lobe. Same focal lesions are seen multiple in all segments of the liver, excluding the segment 1, that is the caudate lobe of the liver. This is a magnified view. These lesions, if we concentrate on them, they are very much fulfilling the criteria of bullseye appearance, echogenic with hypoechoic halo, and no posterior wall enhancement, solid focal lesions which are consistent with metastatic liver disease. This is a case of diffuse metastatic liver disease. The portal vein is patent, sarcoplasmata. The blood flow velocity is okay. Thank you. Sorry. Okay. Let me magnify and show you the solid, well demarcated hypoechoic lesions, which are all consistent with the METs. These are all metastatic lesions, these rounded areas. So, one of the findings is that the liver is coarse, mildly coarse. We see the texture of the liver is coarse, and the liver is, all segments of the liver except segment 1 are studded with small, rounded, well demarcated hypoechoic areas, few of them giving a bullseye appearance. So this is, these are two findings over here. Now this is the para-aortic region. Yeah. This is the aorta. This is the lymph node, and we see that the superior mesenteric artery is being elevated by the lymph node in this region, known as the nutcracker sign. These are all lymph nodes. This is the larger one. So now the lymph nodes are seen throughout the paravertebral region. You see the aorta, and now this is the aorta. These are all lymph nodes. This is the lymph node. And this is the IVC. Here you're seeing the IVC, and below the IVC again you see hypoechoic areas, well demarcated. These are all lymph nodes. Now this is the splenic hilar region, showing you the renal artery, right renal vein. This is the transverse section of the right kidney, and you can see that there are multiple hypoechoic, well demarcated areas seen, and these are lymph nodes in this region. So paracaval region, these lymph nodes are in the region of, these are the paracaval lymph nodes, all of these, this one, all. However, this is IVC. And aorta. If I follow the probe in the midline, we will see the lymph nodes on both sides of the aorta. This is the aorta, and this is the left side. Again. Now these are lymph nodes. No blood flow within them. This is the right side. Now this is the aorta. This is the right side. See the number of lymph nodes and the size of the lymph nodes. They are very large and matted together. Large and matted together. So you can see this is the aorta, right side, matted lymph nodes, left side, matted lymph nodes, and the aorta. Bifurcating now. I will show you the bifurcation, at the level of the bifurcation of the aorta from the L4, L5 or umbilical region. This is the right iliac vessel. There. And this is the left iliac vessel. We do see lymph nodes in this iliac vessel, lymph nodes, and in the peritoneal cavity, the uterus is normal, the ovaries don't show any pathology. However, free fluid is seen. This is the ascitic fluid, uterus in transverse section, urinary bladder. This is the ovary. These are the bowels. So no pelvic pathology. However, there is fluid. This is ascitic fluid. And this is the uterus in longitudinal section. Moreover, the spleen, this is the diaphragm, left diaphragm, and this is the spleen, which measures approximately 15.5 centimeters. So this is a case of chronic liver disease with splenomegaly with paravertebral plan and CAVAL plan adenopathy along with diffuse metastatic liver disease, ascites, and this is our case of the day. Thank you very much.